Hi guys, my name is Giselle Robles. I'm going to be doing my presentation here on capgras delusion, otherwise known as capgras syndrome or even imposter syndrome, as you'll see on this slide here. So what capgras delusion is, it's where someone believes that either their loved ones, animals, objects, or even their own home is an imposter. So they literally believe that that person or item is an imposter that is going to harm them or bring them distress. So we'll move on here to where it's most common. Typically, the most common place you'll be seeing this disorder is in patients with Alzheimer's, dementia, and schizophrenia. Alzheimer's, if for those of you that don't know, it's an irreversible progressive brain disorder. What it does is that it slowly destroys your memory, thinking skills, and eventually the ability to carry out simplest tasks. So it can cause an altered sense of reality for this person. Next case would be dementia. So dementia is a decline in mental ability. It'll interfere with your daily life as well, and it causes an altered sense of reality because what it is, it's memory loss. So let's say, for example, a patient with dementia saw their caregiver and didn't recognize that person as who they were supposed to be. That's what can cause that altered sense of reality and cause capgras delusion. Another part that can happen as well is schizophrenia. So schizophrenia is a breakdown in the relation between thought, emotion, and behavior. So it can lead to faulty perception because they have inappropriate actions, feelings, withdrawal from reality, and it's more of like a fantasy and delusion, and a sense it's like a mental fragmentation. So there's only parts of it, and at times they might hear voices that are telling them things to do, and those can alter a sense of reality as well, obviously. So that's why the person would think that they're imposters in their homes, or even if their pets were imposters. In rare cases, though, brain injury can also cause this disorder. So it can happen because there might be brain lesions in that right hemisphere where our brains process facial recognition. So with that damage, your brain isn't able to function properly. And so that way, when they see somebody, they might not recognize them. For example, like if you saw your sister and you're like, that's not her, that's why you think there'd be an imposter there, is because your brain isn't working properly there. One of the big causes as well is seizures. So that goes back to that brain damage here. So seizures can cause that malfunction of neurons trying to connect and cause damage as well. Other researchers may believe that it could even just be a physical change in the person's environment on day-to-day activities. So let's say if someone who's older went and they moved somewhere completely different, and if they saw the person they knew in a different area, it can cause them to think that they're the imposter. As well as physical changes, emotional ones can affect your brain as we error in perception. So what that means is that it coincides with any damaged or missing memories. So some researchers call it as a feeling of disconnectedness. So that's like where if you don't remember, like I said, you moving to this new place, emotionally you're going to be distressed. And when you see, for example, your mother or your father, and you think these aren't my parents, I'm in an altered reality, this isn't it, these aren't the people that I know. So let's bring it back here next. Let's talk about who discovered capgras delusion. So it was discovered by Joseph Capgras. He was a French psychiatrist, and he first described the delusion. He wrote a paper on a 53-year-old woman. This patient was a paranoid megalomaniac. So what that means, it's a person that's obsessed with their own power. So she transformed everyone in her entourage, even those closest to her, like her husband, her daughter, into various and numerous doubles. So she thought that she was famous and wealthy, and these people were out to get her. These aren't her husband. This isn't her daughter. And she thought, because 3 of her children had died, she thought that they were abducted, and that her only surviving child was replaced by a look-alike who was out to get her and her money and to harm her. Let's move on here. So now that we know who discovered it, let's talk about how rare capgras delusion is. So it's more frequently in women, African American people, and schizophrenics. Capgras syndrome actually had a 15% occurrence in adult inpatients with being diagnosed as having schizophrenia. So from that figure, they estimate that a 0.12% of capgras delusion is in the general population. So now that we know how rare it is, let's go into some examples of cases. So here on the left-hand side, I have a 24-year-old male veteran. This patient had disclosed that he didn't believe that his mother was real. So he actually thought that his mother was replaced by government employees who were sent for his illicit confession, for his behavior while in the military. That being such as doing drugs while on duty, leaving his post, and so he thought the government was out to get him. He was then hospitalized. So within his course of treatment, he began to think that his entire family was replaced by imposters. So as it progressed, he began to distrust members of his family, and he didn't want to communicate with any of them when they attempted to contact him. So one thing I thought that was interesting, so this man had past disorders. So he had an anxiety disorder that was documented, adjustment disorder, and borderline personality disorder. I thought that was interesting here because in the next case here, a 40-year-old woman, so she had no evidence of any past mental disorders at all before she began experiencing these symptoms. The patient had stated on numerous occasions that her 9-year-old daughter, Sarah, had been placed in the custody of Child Protective Services, and then she was replaced by an imposter. When they tried to validate that, she reported that she'd given birth to twins, but the hospital record only documented the birth of her daughter, Sarah. So with that, she would show up at her daughter's school and refuse to pick her up, saying that that wasn't her real daughter, that she was in cahoots with the hospital and they know what she did, that her daughter is somewhere and that the child they were trying to give her was nowhere to be found. So I think it's interesting here. So we have the man who had the past disorders and the woman that had none. So if you ever do, so those are some examples of cases. So if you ever do come in contact with anyone with capgras delusion and how you can care for them, big thing is you need to try to enter the realm of reality when possible. It's like that saying, you gotta put yourself in someone else's shoes. So you really have to understand how terrifying it might be for them. I mean, imagine if you came home and you thought your mom was, your mom, and next thing you know, she's not. She's like someone who's a secret agent who's trying to attack you. Like, if that really was a thing, I think we'd all be pretty terrified. So a big thing as well is that don't try to argue with the episode and don't try to correct them. With this, it's like I said, it's terrifying for them when you try to correct them. To them, that's their sense of reality at the moment during the episode. So what you can do is you can try to make them feel safe. So if you're not sure what to do, really the biggest thing is just like ask for help, communicate and see if they're willing to tell you how they can fix the situation. A big thing as well is acknowledging their feelings, whether they're terrified, angry, sad that their mother is gone and their mother's not who they're supposed to be. It goes a long way. I mean, if anyone gets their feelings acknowledged and validated, it really does help. So if possible, you need to have the imposter leave the room. So if it's you and you're the caregiver, you might want to let someone take over until the episode is over. Reason being is that you're just consistently triggering the person. It's just going to start a cycle all over again. I don't know about you guys, but personally myself, if I hear my mom scream my name, I know exactly who it is within 2 seconds. Same thing that works with capgras syndrome. So you can rely on sound and make sure that they register your appearance with sound. So you can greet them out loud before you see them, so that way their brain makes that connection that, oh, this is my son coming to see me. And that way they don't think that you're not their actual son. So another thing that I found interesting when I started researching this, there was another disorder just like this one. It's known as Fragoli syndrome. So patients with Fragoli syndrome believe that many people around him or her are actually the same person in different disguises. So the difference, while capgras, is it causes the patient to think that someone who he or she interacts with on a daily basis has been replaced by an imposter. To give you a quick story here, when I looked it up, for Fragoli's, there's a documented case on a woman who thought that her favorite actor was dressing up as all of her friends and was posing as her friends because she loved her so much. Well, capgras syndrome, like we talked about, that woman that thought her daughter was a replacement, her daughter was not hers. So really, Fragoli's it's the same person in many different disguises, while capgras is like that one person that's been replaced by an imposter. So upon looking at this up here, is there a cure? No, there's not a cure or standard treatment really for capgras delusion. Usually what happens is that psychologists and others will attempt to identify an underlying mental disorder. In some cases, treating the underlying condition can reduce or cure someone's symptoms. For example, like we talked about earlier, people with Alzheimer's or schizophrenia, those can improve the symptoms of capgras syndrome because you're taking away the big picture here, and that'll take away the underlying cause. At times, that might not even work. In some cases, validation therapy may be useful as well. So what validation therapy focuses on, it's someone accepting the misidentification to help them relax and reduce that anxiety. So like we talked about before, that woman, that 40-year-old woman in that past case, medication didn't work for her. Anxiety medications can be prescribed and antipsychotics may be prescribed as well. Doesn't work sometimes. And so then in that case, caregivers and facilities can attempt to ground the person. Frequent reminders of time and place. So for example, it's just like people with anxiety, just giving them physical touch, understanding where they are, just feeling that they're in the present and that they're okay and safe. So it really just varies on person to person and how they can treat each of these things that are happening. And yeah, so that is the end of my presentation. Thanks for sticking it out with me. I hope you enjoyed. Feel free to comment and ask me any questions. I'll be happy to answer them best I can. Thanks.